Hello, everyone. My name is Olivia. I'm 47 years old, and this is one of the most unbelievable stories I've ever experienced. Even now, I'm not entirely sure how I feel about it, but I can't stop replaying the events in my mind.
During my time as a medical student, I encountered a woman deeply committed to homeopathy and natural remedies. Her practices included consuming her own urine. While small amounts can sometimes be harmless, she exclusively drank urine. Due to its high salt content, this led to severe dehydration and acute kidney damage. Though I'm not a doctor, I once took my very elderly grandmother to the hospital after arriving at her house and noticing she was slurring her speech and acting unusually. My grandmother, a notorious hypochondriac, immediately told the attending doctor that she thought she was experiencing early symptoms of Parkinson's disease. It turned out she had accidentally mistaken a bottle of non-alcoholic wine for regular wine, consumed the entire bottle, and was completely intoxicated. As a general surgery resident working in colorectal surgery, I often dealt with conditions like hemorrhoids and anal fissures. A colleague prescribed a cream to a middle-aged woman, who later called back with a question about whether the cream would still be effective during her vacation in Hawaii. When asked why, she explained, "Because I was told to apply it locally." I'm just an accountant, but I once spoke with a diabetic who had read online that cinnamon could regulate blood sugar. Convinced this was true, he stopped taking his prescribed medication and relied solely on cinnamon. Unfortunately, this decision led to the loss of his big toe due to a diabetic-related amputation. As a respiratory therapist, I've gotten some amusement from reading public comments on articles about COVID. A standout comment was, "Ventilators are killing people. Patients who can breathe independently fare better on high-flow oxygen." Sure, because we choose to intubate people just for fun on a slow day. Not because, as in severe COVID cases, their oxygen needs have surpassed what can be provided through less invasive methods like BiPAP. Another gem was, "COVID isn't a lung problem, it's an issue with gas exchange." Right. And where does gas exchange primarily occur? That's correct, the lungs. I also had a patient who denied having COVID, and even asked if the swab we used for testing might have been contaminated by other positive samples, claiming he'd heard that could happen. For the record, all our tests are individually packaged. We also treated a couple in their 60s who both had COVID. They were initially in separate, smaller rooms due to space constraints, but after about a week, we moved them into a larger shared room when it became available. The man's condition was especially dire, and most of us didn't think he'd make it. Their daughter stayed almost constantly, and many of us spent a lot of time discussing treatment options and managing her expectations. She mentioned how living through the situation was so much different from what she had anticipated based on social media. At one point, she asked me directly, "Are these rooms becoming available because the previous occupants died?" I didn't sugarcoat it. Yes, that's exactly why. She just nodded, though I doubt she had expected that level of honesty. You wouldn't believe how many people tell me, as a type 1 diabetic, that I could free myself from big pharma and my reliance on insulin simply by eating a proper diet. I'm already slim and otherwise healthy, but type 1 diabetes is an autoimmune condition that requires insulin since my pancreas doesn't produce any on its own. These conversations typically leave me staring at them blankly. I often have to clarify for junior detectives and families that an autopsy doesn't work like it does on CSI. I can't just deduce the murderer's sex, height, dominant hand, or motive unless there's very specific evidence to support such conclusions. I don't fault them for misunderstanding, though. I blame CSI for setting such unrealistic expectations. About a decade ago, a friend of mine sought out a faith healer to address wrist pain caused by drumming and invited me to tag along. It turned out to be the most absurd thing I've ever witnessed. He paid $200 for her to wave her hands over his wrist for 20 minutes while soothing panpipe music played in the background. Unsurprisingly, this didn't resolve his carpal tunnel syndrome. Shocking, right? It did make me wonder if I'm missing out on easy money, considering how gullible some people are. Just the other day, a woman in an elevator glanced at my badge and said to me, "You know those blue hospital masks only work for 30 seconds, right? After that, you might as well not wear one." I genuinely didn't know how to respond. I'm not a doctor, just a nurse, but a doctor friend in the ER once had a patient who had inserted several garlic cloves deep into her vagina. She had read online that garlic could help with certain infections and yeast issues. While garlic does have some antibacterial properties, it needs to be used carefully and correctly. During a routine office visit, I recommended the COVID vaccine to a patient, but he told me he'd read online that it contained a microchip and was created by the Illuminati. I pointed to his smartphone and said, "You're already being tracked, my friend." Not sure about that Illuminati 5G family plan, though. A pharmacist friend once shared a story about a 17-year-old girl who came in with her boyfriend to pick up birth control for the first time. They were given a 28-day supply, didn't ask any questions, and left. However, 2 weeks later, they returned, saying they had run out. The girl explained she'd read on Facebook that if both partners take the pill daily, it's twice as effective because it supposedly gets into the guy's semen. My friend had a lengthy discussion explaining why that logic doesn't work. We definitely need better sex education in the US. As an RN, I had a patient with diabetic foot ulcers who read online that salt could dry them up. He placed his foot in 2 plastic shopping bags filled with rock salt, essentially turning his foot into something resembling prosciutto. The result was so severe that most of his foot had to be amputated. Since then, I've privately nicknamed him Hammy. While working as a nurse practitioner in urgent care, I once had a patient tell me he spent $5,000 of his own money, since insurance wouldn't cover it, to get an MRI of his shoulder. The reason? His arm would go numb and tingly when he held it above his head for extended periods. I stared at him in disbelief for about 5 seconds before moving on with the consultation. I'm a medicine doctor. A while back, during a clinic visit, I was discussing preventative care with a patient and encouraging them to get the COVID vaccine. They declined, so I offered to address any concerns they might have and provide answers to any questions. After some time, they told me they still wouldn't get the vaccine. I respected their decision and mentioned that I had received mine in December 2020, and I was thankful for it since it kept me safe while caring for COVID patients. They stared at me blankly for about 30 seconds before replying that I should start preparing my will, because, according to what they read online, everyone who gets the vaccine dies within 2 years. I tried to share evidence and continue the discussion, but it became clear I wasn't making any progress. I'm not a doctor, but someone once told me to drink bleach to cure my diabetes. Sure, that would cure me, because a corpse can't have diabetes. Though I'm not in the medical field, I remember 2 stories from my time as a student with friends in medicine. One involved a woman who kept getting pregnant only months after each delivery. Her doctor advised her to start taking birth control pills. She returned later, pregnant again. The doctor asked if she had taken the pills. Yes, she replied. I mixed them into the food before serving my entire family. In another case, a mother brought in her baby with an unusual skin condition on its buttocks. After exhausting all other options, the confused intern asked the mom to demonstrate how she cared for the baby. When it was time to change the diaper, the mom requested a glass of water to pour into the diaper, just like in TV commercials, before putting it on the baby.